Now, this could change how you feel about what is making you sick. Hi, my name is Dr. Kristina Turkewitsch, and I am a corrective care chiropractor in Newmarket, Ontario, Canada. So tell me if you've had this experience where you have gone to a chiropractor, you started getting adjusted, and then you start feeling just a little bit funny or a little bit off. You may have cold or flu-like symptoms, nausea, pain or muscle aches. And this reaction is actually pretty common. So we see it a lot. The reason why you have this reaction is because chiropractic adjustments help to release toxins that have built up in the body. So you can have this toxic release reaction. Now, the other side of it is that these toxins that are building up in the body can give you some significant physical symptoms. And as a result of this, you might actually be having difficulty getting some answers to why you're feeling the way you feel, because you're getting, tests done and maybe things just are looking normal, and so your doctors are like, well, everything seems fine, but these things have been building up in the body, and a lot of the time that's how you get these reactions, or you get the sensations that you're getting. So this is kind of a little bit of a different look at what toxins are making you sick. So I wanted to touch on this because it's something that does come up a lot, and people always think about it as, the toxic release from a chiropractic adjustment, which is very common and can have a lot of not so fun symptoms. But I just wanted to touch on the other aspect of when these toxins get to a certain level, these are the symptoms you're going to feel. So you really need to work on getting rid of these symptoms, and ideally seeing someone for this, seeing a chiropractor to help you release these, because the levels may just be getting too high in the body. And you need to optimize the processes and systems in order to start to release these things. So this video is for you if you have been having problems with your health in certain ways and there are no answers for you at this point in time. So I'm hoping this gives you a little bit more insight into that and encourages you a little bit that there is a way that there is a way that for you to get rid of the symptoms that you're feeling. So what toxins are these? And these are common toxins that get released from a chiropractic adjustment. And there are 7 of them in my list that I have here. Although this is not an exhaustive list, you can have certainly more than this, other things. But these are generally the most common ones. So what are common in the body are the metabolic waste products or byproducts. And these happen from cellular metabolic processes that happen when we ingest things, when we breathe in, and all of these other things. And so these products can start to build up in the tissues. So we'll go through adenosine, we'll go through lactate or lactic acid, we'll go through ammonia, urea, histamine, and also prostaglandins. Now, the first of these metabolic waste products is adenosine. And it is created by certain cellular molecules inside and outside of the cell. So you'll find it inside the cell, you'll find it outside the cell. And what happens to your body when you produce too much adenosine? Now, while low amounts are actually good for the body and will help your body, especially with sleep, when you have too much, so excess of adenosine, you'll have more negative effects. And some of these are, daytime sleepiness, addiction, immune imbalances and issues, and even asthma. Long-lasting increases in the body are really associated with the chronic inflammation, fibrosis, and also organ system damage or organ damage. So it's pretty significant. Now, the next one would be lactate or lactic acid. And this is created when your cells break down carbohydrates for energy. Okay, so we see this a lot in muscle cells with exercise. Muscle cells, red blood cells, they make the most lactic acid, but it can come from any tissue in the body. So the lactic acid reaction in the body is, it normally builds up in the muscles after hard exercise. Okay, so those DOMS, or those delayed onset muscle soreness, is what that stands for. That happens because of, well, lactic acid is a contributing factor to that pain that you feel in your muscle. And it's a normal way that your body fuels your muscles when oxygen is in short supply. If you exert yourself too much, so you overdo it, lactic acidosis can happen. And this leads to symptoms like nausea, vomiting, breathing problems, okay, and abnormal heartbeat. Number 3 is carbon dioxide, our good old CO2 that we expel when we breathe. And basically this is created because the ingested nutrients that we take in of glucose, right, via eating, and oxygen via breathing, they combine into energy. And when this is broken down in the body, we create carbon dioxide. And excess carbon dioxide can cause the blood to become slightly more acidic. And this condition is called respiratory acidosis. It's more extreme, and it can really encourage the formation of uric acid crystals in the joints, which lead to gout. So overproduction of carbon dioxide that kind of still circulates in the body can lead to gout. Number 4 is ammonia. When you eat proteins, the body breaks those, like the proteins, down into amino acids. And so ammonia is produced from these leftover amino acids that start to circulate. They really need to be removed from the body. So the liver enzymes, they change ammonia into urea. And then this is what you excrete in your urine. Right? So that's one way to get ammonia/urea out of your body. Excess ammonia in the body starts to create neurological symptoms. And that includes like loss of muscle coordination, difficulties with walking, speech, can create behavior changes, confusion, headache, vomiting, lack of energy, and mental alertness, or being just very sleepy and, you know, feeling irritable. Now, number 5 is urea, which is very closely linked, okay, to ammonia. But if things aren't converting properly from ammonia to urea, then you'll have more ammonia buildup, but then urea buildup. So that's a product of ammonia metabolism. So if you have a lot of ammonia, you most likely will have a lot of urea in the body, and excess urea can cause problems with thinking, remembering, feeling tired, shortness of breath, metallic-y taste in your mouth, muscle cramps, and itching. Okay, so you can have like some skin reactions. And so it is neurological based as well. So ammonia and urea have a lot of neurological associated symptoms. Now, number 6 is histamine. And this is released by immune cells. Now, when immune cells bind to antigens to remove them from the body, they release histamine. And it's a reaction so your body can start to fight the foreign invader. A good example of this is when you have, you know, an allergic reaction, right? This is common. We see it a lot, especially with seasonal allergies or allergens to animals, animal dander, that sort of thing. Now, when your body releases histamine, a lot of the time it has kind of a negative reaction, and this causes you, right, to sneeze, have a stuffy nose, runny nose. You can really start to feel like you're getting sick. So a lot of the hay fever-like symptoms that we get, especially at the big allergen, you know, seasons like spring and fall, you can start having that hay fever action happening. Now, having too much histamine in the body, you can develop some intolerance to it, and this causes a lot more systemic issues. So you'll have more like diarrhea, bloating, nausea, vomiting, headache, shortness of breath, again, itching and hives is a big one, right? So people break out into a rash. Sometimes you don't know why, but you're having a histamine overload reaction. And worst case, you know, a big one is anaphylaxis, right? So it becomes even worse, where your body is so distressed, it will start to attack and close off your breathing, swelling, all this not really fun stuff. Number 7, and the final one I'm going to go through, is prostaglandins. This is a big one, especially from a chiropractic point of view, because prostaglandins like to build up in areas of inflammation. It is one inflammatory mediator, and it gets into your joints, and this is something that can cause a lot of joint pain. And so basically, prostaglandins function as signals to control different processes in the body, depending on where you are in the body. Prostaglandins are made at sites of tissue damage, and also related to infection as well. They cause inflammation. They cause inflammation and redness. Also, pain and fever is part of that process as well. And a lot of the time, doctors will recommend anti-inflammatories because it helps with inflammation, right? But the problem is you're not actually getting rid of the issue. You're just kind of covering it up. And so chiropractic really helps with this one as well, because when you adjust the joint, it actually will start to release those prostaglandins and start to remove them out of that joint. So if you have too many prostaglandins in the body circulating, this will cause chronic pain. It also causes, increased pain sensitivity and arthritis. So you'll have more degeneration of the joint. And for our ladies with their menstruations, you'll usually have a lot more menstrual cramping as well because of this. And so this is just a really kind of quick overview of some of the toxins that could be affecting you, and that you would really benefit to start to release from the body and flush out of the body. And so if you haven't figured it out or realized it yet, this is your sign to start, to see a chiropractor, or to start back at a chiropractor if you haven't been in a while, and start seeing a chiropractor regularly. You really need to make sure that, these specific metabolic toxins are being released from your body in a regular fashion, just to make sure things are functioning more optimally. Right? We can always optimize, and chiropractic is a great way to do that. We want to make sure that your body is functioning at its best so you can feel your best. And I have a lot of patients, who come in and say, oh my gosh, this is something that I had for so long and nothing ever helped, and the doctors kind of scratched their heads. They didn't really, understand what was happening. They couldn't really find the problem. But after getting adjusted for, X number of times, I start to feel this release. I start to feel so much better. So thank you so much for watching. I hope you found this video interesting and valuable, gave you some information that you didn't know, that made you look at, how you're feeling differently and give you a different perspective. So please feel free to leave some comments below on what you've been experiencing, or any questions that you might have. I'd love to hear from you. And up next, I have a video about, how to deal with toxin release after a chiropractic adjustment. So I'm going to add that right here so you can keep learning more about this. And I really hope it helps you. Thank you so much.